Imagine how you would feel if you got a telephone call saying that your child or your infant has become lifeless and not breathing. Parents around this world get this telephone call every day. How can this happen? If you leave your child or infant with someone that can't handle the stress of taking care of a child, or doesn't know how to meet the needs of a child. To prevent a child from becoming a victim of shaken baby syndrome, you must recognize situations that put your child at risk. Today I'm going to explain what shaken baby syndrome is, the harm it causes, who it affects, and how to prevent it. So what exactly is shaken baby syndrome? Shaken baby syndrome is a serious brain injury resulting from a child being vigorously shaken. Shaken baby syndrome is the leading cause of death in children in the United States. The average age is from 3 to 8 months. In Time magazine 2009, the article Shaken Baby Syndrome on the Rise stated about 12,000 to 14,000 babies die and suffer injury from being shaken every year. A baby's anatomy alone puts them at a high risk for an injury from shaken baby syndrome. Since neck muscles aren't well developed, they have little support, and the head rotates about the neck uncontrollable. As in my photo, you can see that the child's neck has no support whatsoever, so when you have the baby in a regular position and throw them backwards, the neck isn't able to hold the baby's head up, so it distends way farther than a normal head should. And then when you throw the baby forward, there is nothing here to hold the baby's head from the chin hitting the chest, which causes the brain. This is kind of a picture showing the inside of what's happening to the child's brain. When you're throwing the baby backwards, the brain is hitting the back of the skull, which causes all of this injury right here. And then when you throw the baby forward, the brain is hitting the front of the skull. So just imagine how many times a child is shaken when an adult or a caregiver becomes aggravated. Signs of injuries aren't always apparent on the outside of the body as they are the inside. So after a baby has been shaken, if you don't see like the head swollen, that doesn't mean there's no injuries occurring. The child could have a number of injuries occurring, such as swelling of the brain and damage, subdermal hemorrhage, which I'll explain. I have some pictures to show you to kind of show what that really means, retinal hemorrhaging, and fractures to the brain. Mostly fractures to the brain are if a child actually hits their head from being shaken or if they fall. The retinal hemorrhaging I was talking about this is the eyeball where the light shoots out and gives you a vision when you can see. Well, when all these little blood capillaries bust, all this blood collects, so then no light is coming out. So this can cause total or slight blindness to the infant. And then if you see here, this is a normal brain of a baby. Looks normal, everything's normal, nothing's injured. But then you go down here, and this is the brain of a shaken baby. Compared to this up here, you can see where the brain is starting to expand. And this is the subdermal hemorrhage I was telling you about, when the blood collects on the skull, is all right in here. And sometimes in infants, when you've seen they've been shaken, all of this pressure of the brain pushing the blood towards the skull, you'll kind of see a disformed head to where the head just looks like a big bubble kind of and really smushy. Of those children that survive are with serious damage. And of the serious damage, I kind of have a list of things that happen. And this shaken baby syndrome shouldn't be confused with everyday interaction like bouncing your child on the knee. This doesn't cause shaken baby syndrome, or lightly tossing your child in the air. Everyone does that, so don't get it confused with everyday interactions with your child. But shaking your baby, if they do survive, they could have mental retardation, total or partial blindness. I kind of explained that with the retinal bleeding, seizures, hearing loss, because if they're losing like their balance, then that can cause hearing loss. Developmental delays, we said the ages are usually from an average of 3 to 8 months. Well, when a baby's born until like a year or two old, that's when they're learning to move, to hold their head, to walk, to eat. So if you're ruining all of that, then they're going to have a whole bunch of developmental delays. Speech and learning difficulties kind of goes along with developmental delays. Memory, attention problems, cerebral palsy, which a lot of parents have to deal with, and I'm going to show a video later of a little girl that went through that. And poor balance and coordination, which goes along with hearing. If you can't hear, then how do you expect a child to have balance and hold themselves up? Shaken baby syndrome is 100% preventable. Know who you're leaving your child with. Just don't leave your child with anyone. Make sure that they're, well, not necessarily an adult, but someone that can take on the stress of a child. Are your patients wearing thin when you're caring for a child who won't stop crying? Could there be a chance you lose control of your anger? There are ways to control that. Check for possibilities to lead to the child to crying. Why is the child crying? Have you checked their diaper? Are they wet? Is the child young enough to where they're teeth cutting in? Fever. Is the child sick? Check their fever. There always has to be a reason for a child to be crying. Or are they hungry? Have you tried to feed them? And if the child just continues to cry, then call someone if your patience is wearing thin and you don't think you're going to be able to handle it. Or call a doctor. There could be a reason or a medical diagnosis to the child crying. I've seen on the internet a Dr. Harvey Karps. He is a child doctor. I can't remember the medical term, but his name was Dr. Harvey, and he says to try the 5 S's. Hold on, I'll get to that and kind of explain what they're for. The shushing, when you shush a child, it's kind of like in the womb, that noise that's constantly going on. It reminds them of a womb and kind of calms them down. Then you have the side and stomach positioning. Maybe the child's crying because they're having a hard time with digestion. So if you put the baby on their stomach or on their side, it helps emptying their stomach so they digest more easily. Then sucking, just the comfort of having something in their mouth to keep them content. Swaddling, holding the child close to you, making them feel secure or warm. Even like when a baby's first born, they tell you to try skin-to-skin contact to get the baby used to you. It just makes them feel more secure. Or swinging gently. When they're in the womb, they're constantly moving. It's constant motion, so it tends to calm them down. So try all of these things before you lose control. Never shake a child. There's always a way to prevent it. Just look for ways to do it. And if you can't handle it, call someone that can. If nothing seems to help, contact your physician. Like I said earlier, there could be a medical diagnosis. Maybe your child needs help, so take them to the hospital. And now I have a video to kind of close. Just remember, never shake a child. Always find help. There's always a way around it. And this video is from a real mother that her baby child was shaken by the father. And her baby suffers a few things, and it kind of tells you through the video. And I'll just let you watch this and we'll close.